Good evening, everybody, and welcome to this edition of the Fireside Chat. Every month we try and bring in a nursing leader to unpack stories of leadership, stories of nursing careers, lessons learned on the field, lessons shared, lessons learned from your patients and doctors, and we try and unpack it for our ever-growing NurseIndia and Cygnia Healthcare nursing community. And our past guests have included pretty much the entire nursing leadership of the country. Today, we are privileged to have Miss Gracy Mathai, a nursing legend who really needs no introduction, but I will still go through the paces and introduce her. She's a very special leader in the sense that she's not only had leadership stints in nursing, but also has been one of the few nursing leaders to have led a hospital as the CEO. And she's also had parallel stints in HR. So that's a very, very multifaceted, very wholesome healthcare career that one can have. And we are so privileged and honored to have Gracie Mathai. Thank you for your time today. And to unpack, of course, we have another star, Thankam Gomez, who always manages to bring out the person, the leader, and even the little child in every one of her fireside chat leaders. So, Miss Gracie Mathai is, of course, a veteran in hospital administration with more than 4 decades of experience. After her graduation in nursing and then postgraduate diploma in hospital administration from the very famous Tata Institute of Social Sciences, Bombay, she also followed it up with a master's in HR from Mumbai University. She's worked as the nursing director in Mumbai, in MIMS Calicut, and then shifted to HR in MIMS Calicut before becoming a chief operating officer at MIMS Kottakkal for 2 years. She was also the chief quality consultant at Aster DM Healthcare for 4 years, and then, of course, the CEO at Baby Memorial Kochi.
No,
Currently,
Calicut. It is
sorry,
Calicut.
sir, my bad, at Calicut. Currently, she is the director for quality and governance as and advises the hospital and really the fraternity as the group chief of quality and governance. So without further ado, may I welcome once again Gracie Mathai and Thankam Gomez. Over to you, Thankam.
Thank you so much. Thank you so much, Indrani. And once again, ma'am, we meet here.
I
And
know.
I think when I started Cygnia Healthcare, we had one round of conversation. I used to call it in conversation with TG. And that is a video which has got probably one of the highest views so far, when it comes to personal interviews. So thank you so much for making this time to be with us and welcome all the participants who have joined us here and who will be watching the recording also in the future. And as Indrani told, Nurse India and Cygnia Healthcare, we are doing all that we can so that we can make the current generation and future generation to learn from the people who have already done their bit and they continue to do so. So, ma'am, once again, a very, very warm welcome. So, I know you are in Onam dress, so a very happy Onam. I understand 5th of September is the Onam, another 3 days. So, you look very, very graceful, and you always
Thank you.
had been graceful. I always used to admire the way that you wear your saris. So
My name is Gracie.
I know that's why you are so graceful. So, ma'am, usually we start with our first question, maybe going many years back. How and when did you decide to become a nurse?
Oh, it's a really a very important question because I never thought that I will become a nurse. I wanted to become an engineer at a Tata, and where my uncle was working, and he wanted to take me over there.
Okay.
That olden days, some 50 years back, 50 years, almost 50, 55 years back, when a girl is going, not only girl, even the girl or boy is going out of the house, they go and tell their family members, like mother's family, father's family, oh, tomorrow I am going. So all will come home and there will be a big prayer, and then they send the girl out like this. So that way, that day have come, even my box was packed and everything was ready. And that particular evening, my uncle is telling, oh, where I will keep her, because my uncle was also unmarried. Where I will keep her? I am staying with bachelors, so where I will keep her? And our family was a combined family. It was not a nuclear family. So immediately, my father's elder brother got so angry, he just slapped him. He said, see, the house is full of people who came to send off her. And now you are telling where you will keep her. Why do you did not think of this early? I will not unpack this bag. That was his
Oh,
determination. I will not unpack this bag. And everybody in the house is little chaos. Even my father, mother, they were not telling anything. And I am the only one daughter, and I have three younger brothers, and I was the eldest in the family. So my father did not say anything, but my father's elder brother at that particular time phoned one of my phone means that time there was no phone at home. You have to go 1 2 mile ahead where there will be a phone. So he went there and then he phoned, and then my one cousin auntie was the nursing superintendent in Agra, SN Hospital Agra. She phoned her and she said, I want to send her just now because I don't want to unpack the bag which is being
oh,
packed. And
okay.
that time, Tangam, we were at Koranjeri. Koranjeri is near Chengannur railway station. And to tell you, there was no train from Chengannur. The train used to start from only Ernakulam, where it is again almost 6 7 hours journey from my house to Ernakulam. So you have to come to Ernakulam and then you have to catch a train to Delhi and Agra like that. And it really happened. And nobody could say anything to my Bade
Uncle.
Papa. Why? Because he was the eldest. And whatever he says, everybody used to listen. So nobody can say no to him also. So my father also kept quiet, though he was weeping at one side, but he also kept quiet. Now, what has happened? The next day, with that bag, we started from home and to Ernakulam, and it took almost 1 day to reach Ernakulam. We reached Ernakulam, we stayed in one of our far relatives' house, and the next day there was a train. I don't know how now I don't remember whether it was a book ticket or whether it was a casual ticket. I don't know anything. But
Oh,
he just put me into the train which was going into Delhi. And then one boy who was going into military, he was there from that particular Ernakulam. So my Bada Papa talked to him, and then he said, now she is going alone. You know, I am only 17 at that particular time, not even 17 complete. So then he said, she is going to Agra. Someone will come and pick her from the Agra railway station. So you please drop her at Agra. He told that boy. And then, anyway, there were many people also there. And that is my journey where I started. And then I came to nursing. See, because my auntie was the nursing superintendent and she wanted to put me to nursing. And that's why I said it was not by choice, it was totally by chance. But
okay.
once I have decided that I want to become a nurse, or once I have joined the nursing, I was a total, full fledged, dedicated nurse into that fielding. So this is my starting of nursing.
That's really, really very, very motivating because there were other leaders also who actually didn't get into the profession by choice. I mean, that includes me also. I did not. I actually wanted to be a doctor. I mean, very close
Oh.
to healthcare. But you were going into engineering, and I must say thanks to your Papa that our profession got someone like you to talk
No,
to
no.
after so many years of experience. So, yeah, somebody is selling, Indrani is selling that packed bag should not be unpacked. Maybe he thought it is not a good omen, the bag that is packed to be kept. It's like even today also someone says, no, when you leave home, don't come back. In case you forgot something, don't come back. Stay there, ask for the thing, and then somebody will give you the thing. Not that I believe, but I think these are, carried over by our from our elders.
And moreover,
So that
some 20, 30 guests were there at home. They all
I
came
know,
to
I can
our
imagine. I'm
see,
just
see of me. Huh.
when you are explaining, I am seeing the house full of people.
Yes.
Like Bada Papa deciding, you don't want to take care of her. I'm going to make sure that something is done with her today. I think that's destiny playing its own,
Yes.
way, and obviously, suddenly coming out of Kerala all the way to North India. So,
Alone.
how was your initial days in Agra? I mean, did you know Hindi, and how did you manage that language barrier and
No,
all?
Hindi to tell you, because in our school we have learned Hindi. Because in Kerala we have one subject Hindi, no.
Yeah, yeah.
So that, what do you mean to say, that broken Hindi even I was knowing. I can excite that small,
थोड़ा
small
थोड़ा
thing, but
आता है, थोड़ा थोड़ा
yes,
आता है.
yes.
My
That,
interview,
ah,
everybody will say थोड़ा थोड़ा आता है.
with that I could manage. But surprisingly, my uncle who came to fetch me at the railway station, he had chicken pox and he had all marks on his face. You know, that olden days chicken pox, now to, not today offer.
Uh-huh.
And then he is a military officer, tall, stout, and with this big chicken pox things on his face. He just came. As soon as I got out, he asked, "Are you Gracie?" I said, "Yes." "Come, follow me." Nothing else.
Hmm.
So, like what I can tell you, like a small child, I just follow him. And then he was in a bike motor, and then he asked one auto rickshaw fellow to keep my things over there. Okay. And then my thing, and I was going behind him in an auto rickshaw, and he was in front of me.
Okay.
When we went over there, and it was a big bungalow. You know, in Agra, the nursing superintendent is having a very big bungalow. Some
Oh,
12 rooms were there,
oh,
and four servants, two malis, one in the kitchen,
oh,
and one for other cleaning purpose. So this is what the position of a nursing superintendent. SN Hospital Agra. It's a government hospital Agra. It's a big
oh,
hospital.
okay.
And this uncle was also a military officer, but they were staying in auntie's quarters where it was there. So when I went over there, they got only one son. And that son was maybe looking some, maybe at that time, he may be some 12 years or something like that, much younger to him. But what was the discipline in the house? Nobody should talk.
Oh, sure.
And total discipline. And in the dining table, you should not speak, and you should not turn this side, you should not turn that side. So much of discipline. 3 months I stay over there, because my interview for nursing took almost 3 months, because there is a time now. It was for a government selection, the entire government, I mean UP government selection at one place, and then they post you different area. That was at that particular time. And then when both of them go, I and this boy, we playing and chatting and all those things like that. But by the time the father and mother come, we both will go to both sides. We will not never speak. But in between on the dining table, he will show me something like that. Then they will look like that. So that 3 months were such a frightening. But what has happened? There was a maid who was a cook. She actually taught me little more of Hindi, and this boy also taught me little bit more of Hindi. So within the 3 months, I can tell you, I could learn Hindi. And you will be surprised. I have gone for GNM. My GNM exam was in Hindi,
Oh,
and I got first rank.
oh, wow.
That is what in the state. So that's what I don't know. It's all God's grip. It's all what I can say. I was a brilliant student in in the school also, but at the same time, I never thought that I will pass in Hindi like this. But anyway, that was my early period. Now, if you want to know after joining the nursing, then I can explain some more thing. You want to know?
Now, I would like you to just reflect a little bit on that government hospital training. How did that? Because this is not something that we have come across in any of the fireside chats, because either military or it is private. So I'm curious to know, because
Okay.
having a bungalow of 12 bedrooms, unheard of. I'm very sure this is from the, British era, that building must have
Maybe,
been.
maybe.
Yeah, yeah. So maybe you would like to recollect how was your, that learning period.
Okay. See, after the interview, I got the posting at Agra. No, sorry, Allahabad. I
Oh,
got the posting at Allahabad. So, MLN Hospital, Allahabad, where I did my general nursing, Motilal Nehru Hospital.
Okay.
Okay, because one place interview will be there in each year, and then they send the students to all the government hospitals. Like that, they send me over there. And my auntie was there in the Agra, so I was never with auntie afterwards. Only
Okay.
sometimes in between I went and saw her, or she came to me. That's much only that. In my batch, okay, only 7 students were there.
Oh, okay.
Four were Malayalis and 3 from UP. I mean, that same place like. And so we only 7 were there. Fortunately, we had the principal teacher, whoever at that particular time, she was from Andhra Pradesh, I mean South India. And
Okay.
then she loves the Malayalis little more. Rather, I won't tell you it is a partiality. What she says that when Malayali girls leave, I mean South Indian girls, let me talk about South India. South Indian girls, when they leave their family and come to Delhi, their food problem, their language problem, they will face so communication problem, all those things. She was really understanding all those things. So she had little concern about all 4 of us. Now, maybe by virtue in my student life itself, I used to speak, I was little outspoken. And my communication, and I never hesitate to say even wrong Hindi word also. I will say only the people should understand. My purpose is you should understand whether it is striling or pulling or feminine or masculine, I don't bother. And people used to teach me also that many times you are using feminine to those things were there, but still I don't bother. I said, have you conveyed, understand what I wanted to say? So that was my thing like that. And though they even, the reference books were, our textbooks were in Hindi, but the
Oh.
reference were in English, same like today what we have. So she used to tell me, that is Madam Vetish, Battish, she's from Andhra Pradesh. She used to tell me, Gracie, you read this, and evening, what do you have to do? Take all 7 of them and teach them in Hindi. So I started learning by myself. Rather, I was also not knowing much, but maybe little better than all others. That's what I just consider now. So I started learning by myself. Then I started explaining them. And the next day, with so happily, teacher will ask, how was the day, whether Gracie said you this thing, and do they all say, oh, she taught us this. As such, I have not done anything, maybe a little bit here and there. And then this and that was my day. To tell you, my preliminary period was very, very happy, and there was no problem, and there is no harassment from the senior. And moreover, people started talking, she is the pet of Sister Betty, so no one could say anything to her. She was the principal. So that way, little message also is being spread. As such, I have not done anything special to her. Rather, she also not have done anything special. She used to bring idlis and all. She used to give all 4 of us. She used to call us and give to us because you are Malayali girls. No, you are missing this idli. No, so like that, she used to help us something like that. Otherwise, there is nothing. But my days were very smooth, to tell you. Uh, there was no harassment. There was no problem from seniors. But at that time, I felt harassed, but now I feel it was a privilege. Our public health nurse, she will come and sit in the dining table where we eat. And you know what was the food? Chapati, rice, 1 sabji, and a katori full of dal. And in Kerala, we never have the habit of having dal. Never. Recently, I think now we started dal. Otherwise, dal was not at all over there. And now this lady will sit over there. And twice a week, we get non-veg also, like chicken. And this lady, the public health nurse, she will sit there and she will see that all of us will eat everything. So how we used to do? I will give my chapati to that Delhi girl and I will take her vati of rice. So we 4 Malayalis were there and 3 those Delhi people. So what happened? We share their rice and we give our chapati to them. And then we used to eat like that. And that dal, I was not at all having that taste because we have that more curry and all those things in our house now. Then she will say, no, drink full, drink full. So forcefully she used to ask us to drink full. Now, one thing I feel, maybe because of that, the sufficient nutrition you got, and I was only 36 kg when I went for nursing, and I went to, after 1 year, my weight was 50. You can imagine how much I mean, my weight is increased because she was so forceful making us to eat and drink all those particular type of things. And then moreover, though it is a government hospital, see the housekeeping person and the teachers, they all celebrate Diwali, Christmas. These 200% they celebrate. So during this Diwali and Christmas, they prepare various sweets. Depend upon Diwali, they prepare Diwali sweets, and during Christmas, they prepare Christmas sweets. And each one of us will get one full plate of sweets. Morning when we go over there, they'll be giving one full plate of sweets to us on that particular day. So we bring that sweet because we cannot have it at one time. We keep it in our room. We eat that for a week. So that way also we have been taken care by the people. So I don't think I have any problem. Coming to the hospital working, because it's a government hospital, roadside patients have been brought over there, and the patients with maggots, roadside patients, those who have maggots, they have been brought inside, and then we have been asked to clean them. And one day, to tell you my first experience, the police have brought a lady from the roadside, and that lady was looking like a very old lady, a fragile lady. She has been brought in a wheelchair. And as soon as she has been, I think I was at that particular, I'm a second year student. And then as soon as she is being brought inside, my head nurse at that particular, she told me, Gracie, take her directly to the bathroom and give her a total bath and then only bring her to the bed. Then I took her to the bathroom and I gave her a thorough bath under the tap, putting all my that protective things like plastic apron and all and boot and all. I gave her a bath. When I gave her a bath, I found there are big holes around her head and different parts of the body. And when I start looking into that holes, to tell you, it will be wondering that big maggots will be coming out like this. Okay, big maggots. Then I thought, oh, there are so many maggots. How can I help it? So then I went inside and I brought little hydrogen peroxide and pour hydrogen peroxide to all these holes. And so much of maggots start coming. To tell you, one full basin of maggots I have collected from that lady's body. Later part of that lady showed me like this, and I gave her a thorough bath with the soap. Once she's and change her clothes and all, once she is being brought to the bed, she was only a 32 years female, a good looking female, where when she was being brought from the roadside, she was like looking like an old frail lady. But after the bath and all, she was looking so fresh. And that is being, she is being brought outside, I mean, to the bed. And that's my first experience. I'll tell you, I enjoy that. Rather, I was not afraid of that. I enjoy that. In future also, if any patient police will bring from the roadside, in my ward, people used to say, oh, Gracie is expert, give her that. I used to take very positively. It doesn't matter. Maybe all that blessings I have got from them from that time onwards. So that is one of the good thing what I can say during my student life.
Ma'am, take a little bit of water.
I'll take.
Yeah. So I think one very important thing that you mentioned is the blessings. I think it's very important for the current generation to actually realize and appreciate the fact that we are in a profession where we don't have to go out and do any charity. People come to us, and if we are doing our job with our heart in the right place, blessings will automatically follow. And I think that can be seen very, very clearly in your life. So, God bless
I
you.
can tell you maybe that blessing, Tangam, till today, that blessing, maybe till today, God is given me, and I have a very happy family life, and I have another very happy professional life. It's all maybe the blessing what I got from God, I think,
God
from
bless you.
that day onwards.
I'm very sure of that. I never had to handle any patient who had maggots at least. So I don't know how it would have been. I have no idea, but it must have been difficult. But I'm very sure those patients would have been hugely grateful and would have.
And Tangam, I would like to add one more thing. This is in the case of maggot. And there were many ladies who have so much of lice, their hair won't be seen. Is full of lice,
That I have.
and that treatment also we have given. And we know that everybody say that it may spread on you, but still, I don't know, somehow I enjoy treating those people. I mean, taking care of those people, because those, they don't have anyone to take care of them. They don't have anyone to tell them that you have lice, comb it properly or this thing like that. Then I thought I have taken that also into my hands, and I was so happy doing in that. But
Okay.
if you ask me, I have never kept a cup from the dining table inside the kitchen. My mother used to say, go and keep it over there. My father say, no, she is studying, don't disturb her. And that is me at the younger age, though I was not from a very rich family, very ordinary family, but still my father used to support us because we study. So he said that you study, don't do this household work like that. And mommy used to do all other work. And me being in that position also, I don't hesitate to do that work. That's what.
Okay, that's great. So now we are going to fast forward a little bit, and
Sure.
then we are going to now ask you that how and when did you land up into a leadership position? I know even as a young nurse treating a patient with maggot, you were doing acting like a leader for sure. But I'm sure, I think the little that I remember is that your journey started in Mumbai. How did you leave the government job and then got into
Okay, I'll
private?
tell you. I'll be little faster. Okay. Now, I was the SNA president, vice
Oh,
president, not president, vice president at that particular time, even in Delhi. And
okay.
that was the year where the SNA conference was held at Delhi, and Indira Gandhi was the chairperson. I mean, the chief
Oh,
guest. So I
okay.
had an opportunity even to have photograph with her because I was the SNA vice president. And the holding area vice president became the vice president in the main program also. That was the TNA rule like that. Afterwards, see, after passing, I worked 1 year over there, and then I got married, and then I came back to Bombay. That's what my journey to Bombay. I
Okay.
started my career in Bombay Municipal Corporation as a staff nurse. Only 2 3 years I worked as a staff nurse, and they went for uh, uh, post the diploma in nursing education and administration again in Delhi. I went over there, and my children were very small. Children were very small means my daughter was only some 2 years, and my son was maybe some 6 months. Only 1.5 year different only between both of them. And that time I went Delhi again for that diploma in nursing education and administration. It was 9 months, 1 year course, and I came back immediately. Bombay Municipal Corporation from the uh, Kasturba Hospital where I was working as a staff nurse, they promote me as a tutor to Bhagwati Hospital, a newly coming up hospital.
Okay.
That also Thangam, God's grace and how it happened. Now, that particular time when this hospital nursing school was starting, the Bombay Municipal Corporation and the deans of the KM Sayan and Nair, they have asked all their teaching staff to go to Bhagwati because it's a new hospital. Nobody wanted to go because at that time, this Bhagwati Borivali was a suburb of Mumbai at that particular time. Now
Oh,
it is in the city. And nobody was willing to go because they all were staying in the city side. And then ultimately, I am the new, I'm what do you mean to say, the latest entry into the teaching profession. They asked me, I said, I can go. But somebody have to help me how to establish a school of nursing because I'm just brand new. Then he said, we will help you. And the SNS, the state nursing superintendent, Madam Durga Mehta, she and that, I can tell you, the dean of Nair Hospital, they helped me to establish the Bhagwati Hospital. Then immediately I have come to Cooper Hospital. There also, so 2 nursing schools I have established. So my leadership from that age God gave me. That only I can say. And then what has happened, we have every year this selection at the center place, either say KM, Sayan or Nair. And we used to go from Bhagwati and then Cooper also there. And there, all senior people are there, and I am the junior most. Why I am the junior most? Because I am the senior there in this hospital. And they all were feel jealousy. They say, oh, Gracie is so junior and she's in the selection committee. And we all are so senior. We are not in the selection. It is not my fault. It's their fault. At that particular time, they have not accepted. So
so
there I went into, so I become the senior tutor. Later, I thought I should go for post-basic BSc nursing. So I went for post-basic BSc. I did only teaching diploma earlier. Now I went to post-basic BSc nursing. Rather, the Mumbai Municipal Corporation deputed me. I went to JJ Hospital and I did that 2 years. I remember my days there. Rather, I have more problem because that's also a big government hospital. Starting my days at 7:30 and ending by 10:30, 11, like that. And with the 2 children at home and all problems. With that, I did my post-basic BSc nursing. As soon as I came back, my post-basic BSc nursing, I got the 1 year only I worked as a senior tutor, and then immediately I got a promotion as the nursing superintendent grade 1, because qualified people will be known as grade 1, and those who come by experience, they'll be grade 2 and grade 3. So I was in the grade 1. That also, and anyway, I don't have time to explain to you because when I was a senior tutor, I have little clash with my medical superintendent on ethics of nursing and attributes of nursing. And then when she called me and said, you have been promoted, then I said, are you happy that if I am holding that post of nursing superintendent, because being the senior tutor, I don't have much interaction with you, but being the nursing superintendent, I will have close reaction, I have to. So whether you will accept me, she immediately embraced me. She said, Gracie, I want people like you. Though we have little difference of opinion, but I like the way you go ahead. And Dangam, to your surprise, prior to me, there was a nursing superintendent who was a Maharashtrian. Okay. And she got a promotion as the state nursing superintendent, and she's gone to the headquarters. And that time I have been given Marathi nurses, Maharashtrian nurses came forward and say that Atta Amja Metranala. I mean, they consider me as their person, being Malayali. And earlier there was a Maharashtrian matron.
Okay.
So they consider me as theirs. And this Maharashtrian matron, she has little partiality. I'm not telling it is partiality, because Malayali nurses were really more working at that particular time. They were hard working. So she loved those people, those who work hard. So you call it as partiality or you call it as something else also. And so these Maharashtrian sisters, so she used to shout at them, look at these Malayali girls, how they are working. Why can't you people work like that? She used to ask them. So there was always little here. And every day there is a union problem in near matron's office, like that is matron Murdabad, this Murdabad, Jindabad, every day like that. Okay. Then I was also thinking when I become a matron, the same matron grade 1. So the same thing happened to me. But those same junior people, union people came and told me, madam, we are so happy with you. We will never will have this Murdabad in front of your office. And Tangam, to tell you, there was no Murdabad when I was there in that office. Till I retired from there, I relieved from there and gone to Lilavati Hospital, a private firm. No Murdabad. So the things, that's why I tell you, my way was very easy. Every cooperation from every corner, be it from the superior, be it from my subordinates, be it from my juniors, a great cooperation I got. And then later part, what has happened, Lilavati, when this new private hospital has come, and that also I have not applied, but they came to me, they said, we want you to come and join our organization. And there my designation was nursing director. Everybody in my family, except my husband and children, every relative said, don't leave Bombay Municipal Corporation. There you get so much of leave. I know that some 80 days leave in a year you get, either this way or that way. So don't leave, you get pension, you get this and that and all those things. But somehow internally in my heart, it was telling that leaving it and joining Lilavati will be a great achievement for you. Maybe lead you for a better growth like that. Anyway, somehow I just prayed to God and my God answered me, yes, if you wish to go, you go. So I left Bombay Municipal Corporation and then I joined Lilavati Hospital as a nursing director. 5 years I worked there as a nursing director. And I know now many of the people whom I have trained in nursing at Lilavati Hospital, they all are now NABH assessor. They all are in the highest position. If anybody may be listening to this, they also will know that, yes, it is that I have grown, I helped them to grow. That's what my attitude was, not my growth. My attitude was to help my people grow. Let my people grow. So that was my basic
I'll
attitude.
just stop for a second before I forget, because what you are sharing, are the real true leadership attributes of great leaders. You know, one thing that in your municipal corporation assignment, you had people with you all around from all the department. I think a nursing head who can be that even in today's time, they will find their life far more easier. And a very important thing is that when you have the right set of people, even a medical head who did not agree with you on certain aspects, they still appreciated. So many a times the leaders sometimes they think to be a pleasing person may be the easiest way. Probably not. A smart people around you will see you through that, you know, you're only trying to please. You're not trying to do the job. I think that's a great lesson. And then the second thing in your Lilavati stint, what you told is, I allowed others to grow. I think that is the most important takeaway for anyone in this profession is that as we grow senior, if we are not facilitating growth of the people who are below us, you know, who are younger to us, I think we are not doing justice to our profession. Because how can our profession sustain if we don't pass on and pass on what we learned and allow others to flourish? You know, I can see a lot of people in the comment box agreeing with, you know, your influence in their life. So I think that is a profound, you know, personal experience of true leader. And so you were there in Lilavati. Lilavati stands out to be one of the premier hospitals in the country where all the Bollywood stars and everyone used to go. Do you remember anything very special about any actor or actress who landed up in
Oh, yes,
Lilavati?
yes, Amitabh Bachchan.
Oh, really? Oh my
You must be
God.
there.
I would have
Almost.
loved to be there. So he's my
Mm.
favorite, you know. So
Not only that, many actors, many actors.
I know, I can imagine. Did
And
you?
Tangam, I would like to say one thing over here. You know, this traditional cap uniform has been changed by me in the country. No
Oh,
one else.
okay.
And there was high
Interesting.
resistance from Maharashtra Nursing Council and everywhere. And then, but now everybody adopted that. Now
That's
everybody is
great.
that colorful thing. But I brought that with so courage. I brought at Lilavati Hospital. And when I came back to MIMS also in Kerala, I initiated
Which
that.
year?
Otherwise,
Which year was this? Which year?
it was in 2000. It was in 2001. No.
Oh,
Sorry. 90. It was in 95.
oh, okay.
95.
2001, when I joined Fortis Mohali,
Uh,
I had come from abroad. So
uh,
the first thing I told them, designing the uniform, no cap.
It
So
was
the
95.
people who are, so that means something would have been already there. I was
Yes.
not aware. I
Uh,
was not connected with Mumbai. But in Punjab, I said in Fortis we will not have caps. Simple as that, you
so
know.
1995 to 2020, I was at Lilavati. That time full. I have this
Oh, wow.
colorful dresses for different category. And then I brought that. And my nurse's dress was pink color. I said my nurses have to be in pink.
Ah,
And
great.
senior nurses in all pastel colors, senior nurses in head nurses in blue, and the nurse managers in the green, and the nursing assistant in the lemon yellow. So this is the four color which I have introduced at that particular time. And when I came back to MIMS also, the same thing I continue.
Great. So, from Lilavati, if I understand, I think you then uh, came into hospital administration. Yep.
No, actually what has happened now, my father, I lost my mother-in-law long back. And my father-in-law was alone. So suddenly I got a phone message. My husband got a phone message from my father-in-law that you have to come to Kerala and I want to die in our house. This was where your mother have died. I want to die in our. And my father-in-law was staying with my sister-in-law. So he don't want to die in the sister-in-law's house. He want to die in his house. So just he got the message, and I don't know how God sent the Dr. Abdullah from MIMS that he came to know about me. And then he sent someone and they said, we would like to take you to MIMS. And then immediately I applied and then I came to MIMS. Next day only they sent me a flight ticket for me and my husband. We came to Calicut, and the interview was over, and they have appointed me. And when I went back and I told Lilavati that since my father-in-law is sick and I have to move to native place, I don't have any other option. And then you please leave me. Because of that, he left me. And but one of the trustee, I call her Charu Babi with love. She used to tell, anytime if you feel like to come back, if at all there is no post vacant for your nursing, I'll create a post for you, please come back. And then she has called me 2-3 times in between also that Gracie, can you come? But anyway, I could not join because now I'm well settled over here. That's what. So that is what impact even I created there also, or what they had about me. That's also something different. And again, to tell you one very important thing, till I was there was no union in the nursing and the hospital. As soon as I left, union came, and there were different group of union. There was big this thing and that thing going on in the organization. Whenever I hear, I think because that was a new organization. From the strap, I brought it. And when I feel it is being broken down into various other ways, it hurt me also. But still you can't do because I'm in Kerala and they're there. But anyway, now they are doing very well. At that particular time, it was little problems were there.
I understand. I
Mm.
understand.
And when I was at Lilavati only, I had done my master's in hospital administration as well as MHRDM in human resource management.
Great, great. So, ma'am, I'm also looking at the time. So, if we come till this time when you shifted to Kerala,
Mm.
if you have to summarize, what were those leadership attributes that contributed to you being so successful, and things came to you, automatically? Uh,
Yes.
and that's God's grace, okay.
Yeah.
But apart from that, I'm sure there had been a lot of your input into that journey. So,
Agree.
do you
Agree.
like to list those
Mm.
attributes
Yes.
for
Yes.
our audience?
Sangam, I'll tell you very clearly. I worked only 5 years as nursing director at NIMS. Okay. But during that 5-year period, one of my attribute I can say which brought me is my clinical expertise. My first attribute I will tell you, because even any doctor, even when I feel that they are doing a procedure in a wrong position, I used to correct them. When I can tell you one small thing, like asking the patient to bend like this, and they are doing the either lumbar puncture or something. Then when they see me, they immediately they will get alert because they know that this lady is going to ask something like that. So maybe my clinical expertise is one of my great attitude, what I can say. Second can be my communication skill. I can speak to any level of people. And I never disrespect even the lowest level of people. That's one of my great communication. Everybody, even today, my driver will say, my hospital driver who comes to pick me, he say that before we come, you are always down. For others, when we go, when they see us, they go for taking bath and then they come. But in your case, you are there when we reach there. So I never ask them to wait for a minute because I will go down. I'm in the 6th floor. I'll go down. And that is what communication, I can have an effective communication with any category of people. Maybe, and many of my bosses, many, I can say, whether in Leelavati, whether in MIMS, or whether in Baby Memorial, they usually commonly one word which I heard from them is that when you say something, I cannot say no. This is what everybody, when you ask something, I cannot say no. It means maybe my communication, I don't know that. And I give due respect to everybody. That's one another attribute you can say. Everybody, because it is the lowermost staff nurse is responsible for the outcome of that particular patient. It is not Gracie Mathai as a director nursing or
True.
now as a CEO. It is my nurse who is working at the bedside is more important than me who is sitting in the CEO's chair. That I always consider. So equal important I give my people. And again, if you can ask me another thing, when I look into, yes, coaching and mentoring, I always like and love coaching and mentoring because wherever I get an opportunity, it may be on my round, it may be on my walkway, it may be someone coming to meet me. I won't waste even a single time. I start talking something or mentoring something to particular them like that. And I also tell the people maybe that emotional stability. There's another thing, because nobody can, I will not cry easily if at all any problem comes also, because I am very emotionally stable. And then emotional intelligence, this is also I can say that I hold. That's why I can stand with any of the um, adverse thing whichever is coming on way. And of course, God has given me a leadership skill. That can be one another thing. If I can tell you, I am adaptable to anything. It is not that, okay, this only can be accepted and that is not there. And I always see future. I mean, a visionary, what you can call it. Maybe what can be future? What will be future of my nurses? How how my nurses can be little? How can I raise the standard of my nurses? And that's always my thinking. It will come into that particular way. So that is again one of my maybe good or bad. I may have some fight with my superiors also for raising the standard of nursing at various levels. Even they might have rather ignored my talk also sometimes, but still I don't mind, but I don't stop. I'll go further till they get that particular position, they get that particular place, and that way I used to do. So these are few, whether I can say these are my, and of course now recently I can call it as data driven, because now you want data, evidence for anything. But it was not there earlier. So these are my few attributes, if you ask me, which I have with me. And then I tell the people also.
They are not few, they are a book by itself. That's a complete leadership book. And I think these are the most essential attributes. I don't think that any leader, if they reach any level of any success, especially in nursing. I'm so happy that you took this clinical knowledge part first, because
First.
I that has been my strength. Because I learned this, whoever is the HOD, whoever is the clinician, if they know that you are very sound clinically, they have a different respect for you. They
100%.
don't treat you like any other illness, they treat you differently because they look at you differently. I mean, all the other points are very, very critical and very right. But I definitely want to talk about respect for a minute, because I think that is the key word. In any relationship, even when you are disagreeing, if you are able to disagree respectfully, because you said that you talk very strongly about items, but that does not mean you are disrespecting anyone, right? I think that's the only reason probably today you are getting this feedback. I
Yes.
cannot say no to you. It is all the relationship that you have built over the years, apart from building departments and processes and everything. You may have lot of other skills, but if we don't have people skills, these kind of feedback is very difficult to come by. No, I usually say there will be a tag of but. In many leaders, there is a tag of but. They'll say,
But
oh, she or he is very good,
yes.
know their job, but
Mm.
that but then kills everything.
Yes.
So I think that's why I told you that whatever points you told, whether it is, the clinical knowledge or the communication, the respect, coaching and mentoring, attitude for everyone, adaptability and being resilient. You said that you don't cry that easily. And see, there are two ways to look at it, but then you are able to rise above the problems that came through, right? Yeah.
I can add one thing, Tangam, over here. See, being a nursing person, heading an organization as a CEO for 7 years, I never have any problem with the clinicians, because that's all maybe because of few of this attribute. One thing, my knowledge, and another, my communication skill, another way, how I respect them. I never call them to my office. I'll go to their office and say, are you, sir, are you free? I would like to come and talk to you. But before I go, they come to my office. I said, don't come. You are leaving your patient, I'm coming. There are many people waiting for you. For me, there is no patient waiting outside my office. So I'll come over there and I'll take little time over you. When you come over here, more time is wasted. So this is the way I used to, and that respect even till today. Now, up to December, I was the CEO, and then I have requested my people that I cannot now continue. I'm too tired of this particular thing. So then also they don't want to send me at this age of 76. I am 76. Okay. I don't mind to tell the people my age also. And they said, no, then
God
you
bless
become
you.
the my quality head for the whole group. Now we have 6 hospitals. So
Okay.
they made me the quality. But still, my doctor, when they see me anywhere and everywhere, they always say, oh, madam, we miss you. Madam, we miss you. I said, no, you miss me in that particular chair. But here you will be there. I'm there for you. That's what I talk to them.
Okay, fantastic. You are definitely a role model. You, since you told your age is 76, you don't, God bless you, you don't look 76 at all. And that also is a great motivation for me to think, I shouldn't be, saying no to
I'm old. I'm older.
very quickly, because God bless you. I mean, stay well and continue to contribute to our profession. So now I would like to ask you if you can remember anything that had not gone well in your, the vast experience, and that did not go well, and something that you learned, from that incident or event or whatever. Can you recollect something? Because
I can say, but there are many things but I can say, but the gist of that is that you should never have the knee-jerk reaction. That's the gist.
okay,
Because that's why I said time is running. That's why I don't want to waste your time and my time. In one or two occasion at Lilavati, and then one or two occasion at MIMS also, there was some untoward incident happen. And before my boss come to know the things, I came to know, because being the nursing person, always your people will phone me whether day in or evening or
right,
morning, or so you got. So as soon as I came in both the places, my bosses called me and said, see, madam, this has happened. Are you aware? I was aware of all those things. But still I told them, I said, sir, I have heard of this. I am into inquiry. I'll come back to, but I complete inquiry is over. I know what has happened. But because in that case, I may have to defend my nurse. So they always say, oh, you are defending. You understood now. So I didn't defend. I said, sir, I also came to know. Let me interview, let me investigate, and I'll come back to you. And maybe after 3 or 4 hours, but I have already investigated earlier only. But still, after 3 or 4 hours, I go to them and I tell them the exact things what is happening. Then they realize, oh, it is not the fault of the nurses, it is the fault of the clinician. And to both the occasion, it was the fault of the clinician. But I said, sir, it is not that to punish anybody. This happened like this way. But this is the fact actually what has happened. So learning the lesson, I can tell you, you should never react. Knee-jerk reaction should not be there. Even though whatever is there. See, today, why people suicide? Why people? Because they have, it is the knee-jerk reaction. They cannot accept that fact in the life even for 1 second also. So within that second, they turn their mind. I will say, no, you have to pray God, and then you should have sufficient patience for thinking the thing. And that is a learning what I have learned. I tell all my people, even today, my CNO came to me, I was talking to her, and one another person from Ernakulam came, they just came to talk to me. I said, don't bother about what others talk to you. People talk anything, but don't bother. Look into what you have done, what is in yours, what is good in yours, what good you have done. And always we have to be optimistic. That's what is my thing. Even though anything happened on my way, also see to tell you in my family, 2, 3 times my husband falls sick and I never thought he'll come back. But that time also I put everything to God. I thought, God, it is your wish. It is your wish because you brought me up to this level. It is your wish. I have a very good family. My daughter-in-law is more than a daughter to me. If I don't tell this, no, I will be not be injustice to my own life. My daughter would not have take care of me more than that. She take care of me. My whole family, my grandchildren, everybody. If I say the support what I get from each of my family member is a great thing. That's what. So you learn, and but you also have to be the same way towards them. That's what I can tell you.
exactly. I mean, it is like what you give is what you receive in return, because things don't happen always positively for someone just because you are there. It's also your actions. In Hindi, they call it the cycle of karma.
Yeah.
Your karma comes back to you, and I think very, very powerful reflections, ma'am. What you are saying is that, avoiding the knee jerk reaction, trying to learn to respond rather than react. It takes a lot of patience because, we are all human beings. When something happens, the tendency is to burst out or say something, and after the word goes out, it's too late. You cannot
Yes, which
say,
cannot be
no,
taken back.
I did
Correct.
not mean it. It's very
Mm.
difficult. So I think that's a very powerful lesson for all of us because when we become more well known, or people know you, you are seen in places, there is a responsibility that we carry to respond in the right manner because you are a role model to many other people, and they are respecting you. I think we also carry a responsibility to be a role model. I mean, that's what I believe, so every time when I reflect on myself, I'll always think, when other youngsters are watching, are they able to see something good, learn? So I think your story has been so much impacted with your own optimism, and taking the decisions in the right place, deciding to shift to Kerala from Mumbai.
Yes,
Not easy, right? Coming back to Kerala, it's a different state, you never worked there, and God brought you the opportunity, but you could have still said no to it.
yes,
But I think we all gained with all the transitions that you have done, because you are the first nursing leader that I heard when I came back to India who had gotten into general administration.
yes.
So I said, oh, there is a nurse. Okay. Nowadays you have few more
More
nurse
are there.
leaders getting into it. And also your name is synonymous with, NABH accreditation, etc. So,
Kaho, HPI, everywhere it is there.
yes, everywhere it is there. So, um, tell me on, is there anything funny that you want to share that we don't know about? Something funny in a hospital, in your assignment, maybe as early nurse in your career, something that you don't forget.
No, not forgetful thing is not there, but still I can tell you. See, the people around you are not as per your expectation, and that you have to believe. That's what one thing what I want to tell you.
Okay.
Because you may think everybody will be like you. It's not like that. Never start comparing yourself or someone else with someone else. Each one have their own way of bringing
Yeah.
up each one. So each person is a unique person. But what we have to do as a leader, bring this different unique person to our organizational culture. That's the only thing what we can do.
Okay. Okay. Got it. Got it. So, coming, what are your other talents, ma'am, that we may not know?
Um, in my young age, I used to dance. I used to
Oh,
sing.
wow. Oh,
Even in the church choir, I used to sing, but now not nowadays. Uh, After the COVID, I could not, I don't know anything, but otherwise that. And then I was good in sports.
okay. Okay.
And even up to state level, I have gone. Not in the state level, I won, but district level, and I won many prizes for
Okay.
sports and all at that particular time.
So, what kind of dancing do you like?
Bharatanatyam.
Oh, wow.
Mm.
So you should try to do some of Bharatanatyam even now also.
But
Slow.
every day you are doing. Not every day you are doing.
That's a good one. That's a good one. Every day we are doing Thata Theka only in the hospital. I can imagine. So even as a quality head now, 6 hospitals Thata Theka you will be doing.
That's what I'm really doing. Bharatanatyam between one hospital to another.
Fantastic, fantastic. So, do you have any plans for the future?
To me, for me personal, if you tell me I'm a completely successful lady, okay? Now I'm waiting anytime God to call me. Anytime. Okay. So there is no hesitation to go because all my wishes have been fulfilled. Wherever I have to reach, I have reached in my personal life, in my family life. At the same time, I want, if you ask me, not for me, but I want particularly my nursing profession what I can say, they should actually take the leadership of the hospitals. Because when a nurse take a leadership of the hospital, you know what is the difference? Because she has worked in every department. If you talk about, I'm not against a doctor or any other person. If a doctor, he's a specialized only either in cardiology or neurology or in gastroenterology or in pediatric or something. But a nurse is not like that. A nursing director, she by virtue of her nursing director or CNO post, what has happened, she had an opportunity to see anything and everything, any of the department. So I feel that my nurses should be correctly recognized, and even my nurses also should give their priority to patient care. Their first priority have to be patient care, because ultimately why you and I are here, it's only because of our patient. If patient is not there, hospital can close down. No position of CNO, no position of quality, no position of CEO. It's all because of our patient. So our priority have to be, so entire nursing fraternity, they should focus on their priority on the patient care. That's what. And they also should learn something from everything what they do. Maybe from a wrong incident, or maybe an incident happen. With that also, they should see that they will learn something. Every day we will be learning something, so that yesterday's mistake will not be repeated tomorrow. So that we learn and then we adopt a safe thing. And let our atmosphere be safe for our patient. Every day the hospitals have been brought to limelight, and this has happened, that has happened. Why? I always think, why? Is it only wrong thing happening in the hospital? Wrong thing happening across the globe. Across the globe, every post, if you see. Rather, maybe less harm is reaching to the healthcare. More harm may be reaching to any other category or any of people. But only the medical or hospital things have been brought out into the limelight. So why that? So that is my prayer to my God, that the healthcare people should be given more important, particularly because they handle the life of the people. Others may be handling some property, some money, some other thing, but here the life of the people are in the hands of my healthcare people, including the nurses and other categories. And God have to work through their hands, so that whomever they touch, they have to be healed. And that's what my intention. And we will say doctors are not God, nurses are not God, but no, the patient should see really nurses are angels, because there are nurses who work like an angel. So that is my future. I don't know whether it will happen or not. Let that olden days slogan that you are an angel, let that slogan come back to our nursing field. So let each of my nurse be an angel. This is what my future vision.
Angel who is knowledgeable, clinically competent, who will communicate very well, who will be empathetic, who can make the decisions,
God.
and who are yet confident and resilient. So
Yes.
there are many attributes. Angel should not be misunderstood as someone who is very soft and
Who is organized? Yes.
so angel is someone who actually guards
God.
somebody else,
Correct.
and we
Mm.
have to become the guardian of the
Mm.
patients. Ma'am, I just want to ask you one little slightly tough question, but I still would like to ask. You said that you would like to see more nurse leaders heading hospitals.
Yes.
What is do you really think there are a lot of people who are capable of heading the hospital? If they are there, why they are not getting the chance? And if they are not there, what is the gap that we need to fill in so that they
I think,
people
according to me, I think our organizational setup has not given that important in Kerala, particularly what I can say, or maybe in India, that place to the nurse. I'll tell you, when I was at Aster and I was the surveyor coordinator for the JCI. And when that JCI, 4 people, 5 people came, and when they came to know that a nurse is a surveyor, I mean the coordinator, they were so happy. They said, oh, a nurse is a coordinator. So whereas in NABH, if we say nurse is a coordinator, people may not give that much of respect. So the respect what nurses get in other countries, I don't think that respect we are not getting here. So more and more hospital management, hospital owners, they should come forward and they should judge really the capability of there are many capable nurses. Let me tell you, even whom I come across, there are many capable nurses. And if it is being given into the hand of nurses, I can say there will be much prosperity. And like in the other place where you can say the corruption, those things will be less, because it's my feeling, but I am telling it is. And I don't know, I think that day is not that far. We will see that many more nurses are in the leadership position.
Amen to that. And I really hope that it will truly happen, because I have also seen another phenomenon that happens, that when there is a strong leader who can actually be the CEO, the efforts are made to make sure that person is somehow not there in that organization anymore. That's another phenomenon we are seeing. So it is not easy to be a mediocre leader.
Yes.
You don't get anything. And it's not easy to be a great leader because you have opposition. So I would definitely ask all the audience and all the people who are going to watch this recording, none of this should deter you from doing the best that is required in healthcare. Because when you head a hospital, I only request one thing: never forget the path of the nursing that you have come through. Because
100%.
you did say that we all have to be there for the patients, right?
Yes.
So that focus should not be lost, and it's going to be very tough. And in future, it is going to be even more tougher, because the excels are going to be very tough. And it's already looking, because if you look at the business of healthcare, it is not going to be easy with so much of foreign investment coming in healthcare. All the finances are going to be looking very tougher. But I think it is time that we should equip ourselves with the right set of tools that is required, whether it is a knowledge or a more education in a certain field. It's important. And if you had been a great nurse, that is going to be your strongest weapon, isn't it? I
Oh,
mean,
yes.
from your story, that is
And
emerging out. And me, I had remained in nursing, but I know for sure wherever I worked, it was my clinical knowledge, same things what you told, that came to my, support,
trust.
where people, looked at me and, gave some comments, positive comments. And I will say that, and none of this comes free, ma'am, correct?
Yes,
You
yes,
had to put
yes,
effort.
yes,
You
yes,
had
yes,
to invest, you
yes.
have to invest in your
Mm.
own,
No,
you know,
agree.
attributes and
You even you may have to sacrifice in your certain family things also. Then only you can gain something.
that is true. I think that has been a fantastic deep dive of such a long, very, very successful career. I wish we had more time to discuss more, but I'm going to ask Indrani, as per our format, we ask last some very easy, quick questions, quick round. So the Indrani will be asking whatever comes to your mind, just one or two word. That's it.
Sure, sure.
Yeah.
I was actually thinking that she had taken us to the right moment to conclude the session by saying that her wish for the future is that there should be more nurses aspiring to head hospitals. But anyway, we will reiterate that. Ma'am, a quick funny round, just a 5-second thing. So, are you a morning person or a night person?
I am a morning person.
Are you a tea person or a coffee person?
I am a tea person.
Tea, okay. Are you a beach person or a mountain person?
I am a mountain person.
Okay, you already mentioned your hobbies, of course. We were hoping if you could maybe mouth a dialogue from Amitabh Bachchan's movie, but I will not put you in a spot. But you have spent so many years in Bombay, and I'm sure you know the Bombaya Hindi. So maybe we
Yes.
end this session with one Bombaya phrase that you kept using at work.
Jai Jai Maharashtra Maja.
On that note, thank
Jai
you.
We
Maharashtra
always
Maja.
call.
What is
We
Maja.
always talk. Anytime at the end, anytime any program is there at in our nursing field, we end with the Jai Jai Maharashtra Maja.
What is Maja?
Maja means mine.
Ah, okay. So Jai Jai
Mine.
Maharashtra, my
Jai Jai,
Maharashtra.
mine.
Okay.
Let my Maharashtra Jai. That's what.
Okay, like that Jai Hind, like we
Jai
say
Hind.
Jai Hind, something like that. Do you think that you can hum couple of songs before we say bye?
No.
Okay.
Okay, no problem,
No,
no
no
problem.
problem. But thank
That's
you
fine.
very much, ma'am, for your time today. It's been such a wonderful and just a candid session where you unpacked your career. Thank you, Thankam, for asking the right questions to help unpack such a rich career of 4 decades plus in a little over an hour. That requires a lot of skill too. Thank you to the audience for being there and for all the lovely comments that are there in the chat section. I think all of us go back richer today, picking details from a wonderful career and a wonderful life. Thank you. May God bless you with good health. And thank you, everybody. Happy Onam to everybody too.
Thanks,
Thank you.
Indrani.
Thank you.
Thank you
Thank you.
so much,
Thank you.
ma'am,
Thank
once
you.
again.
Thank you.
Stay
Thank you.
blessed and take care. The profession needs you for many, many more years. Take
Thank
care.
you.
Thank you so much.
Thank
Bye-bye.
you.
Bye.
Bye. Bye.